Good afternoon. My name is Reinaldo Gutierrez. I am currently studying the sixth semester of Industrial Engineering at the Tech Millennium University. Today, for Evidence 1 of the Matter Effective Presentation Workshop, the topic of effects of tobacco and alcohol was selected. The purpose of exposing this topic is so that the audience can know mainly the negative effects to consuming tobacco and alcohol, in order to raise awareness in each of the people so that they stop consuming this type of substances in case that they currently consume them or that they are not consuming in the future for the people who currently consume them. To begin, we will talk about tobacco use. Tobacco use is leading cause of illness, disability, and death in the world. Every year, more than 5 million people in the world die from smoking. It's estimated that half of all smokers die of a disease related to tobacco use, and that stay living in average of 10 to 50 years less than not smokers. The main causes of death from tobacco use are 1. Heart disease, 2. Cancer, and 3. Respiratory disease. Tobacco use generates 3 forms of dependency. 1. Physical, directly caused by nicotine, responsible from the withdrawal syndrome. 2. Psychological. Smoking has become a companion in different situations, and it seems impossible to change this relationship. And 3. Social. Smoking is still a social act. It is done in groups, in meetings with friends, and among adolescents it often has a meaning of rebellion and maturity. Recent studies show that in the 10% of the most susceptible adolescents, the urge to smoke is registered 2 days after smoking their first cigarette. Half of the children who try a cigarette will become addicted to nicotine. This is why it is so important to emphasize that young people do not start smoking. Now we will talk about alcohol consumption. Drinking excessive amounts of alcohol can put you at risk from alcohol-related problems. Long-term alcohol use increases your chance of 1. Bleeding from the stomach or esophagus, the tube through which food travels from your throat to your stomach. 2. Inflammation and damage to the pancreas. Your pancreas makes substances that the body needs to function well. 3. Damage to the liver. When it's severed, it often leads to death. 4. Malnutrition. And 5. Cancer of the esophagus, liver, colon, head and neck, breast, and other areas. Drinking to excess can also 1. Make control of high blood pressure more difficult if you already have high pressure, and 2. Lead heart problems in some people. Alcohol can affect your reasoning and judgment every time you drink. Long-term alcohol consumption damages neurons. This can cause permanent damage to your memory, your ability to reason, and the way you behave. People often drink to feel better or to block feelings of sadness, depression, nervousness, or worry. But alcohol can 1. Make these problems worse over time, 2. Cause sleep problems or make them worse, and 3. Increase the risk of suicide. Families are often affected when someone in the home uses alcohol. Violence and conflict in the home are much more likely when a family member is abusing to alcohol. In general, it has already been concluded to talk about the negative effect of consuming tobacco and alcohol. As indicated at the beginning of the presentation, this information is for the purpose of you knowing that effect of consuming these 2 substances, with the purpose that they stop consuming them or not consume them in the future. If you are currently a person who uses 1 or both of these substances and you consider that you have an addiction or a dependence or thing, seek help from a professional to be able to stop using them. This is not only for your good, but also for the good of your family and your loved ones. Thank you very much.